How does the tuberculin skin test diagnose tuberculosis? Have you ever wondered how doctors diagnose tuberculosis? The tuberculin skin test, also known as the Mantoux test, is a key tool used for this purpose. It helps to detect both latent and active tuberculosis infection by examining how the immune system reacts to a specific protein from the tuberculosis bacterium. The process starts with a healthcare provider injecting a small amount of purified protein derivative, or PPD tuberculin, just beneath the skin, typically on the forearm. This PPD contains antigens from Mycobacterium tuberculosis, the bacterium responsible for tuberculosis. If a person has been infected with tuberculosis bacteria, their immune system will recognize these antigens and respond by creating a localized immune reaction at the injection site. After 48 to 72 hours, the healthcare provider will check the injection site for any raised or hardened area, known as induration. The size of this induration is crucial. A larger induration usually indicates a stronger immune response, suggesting that the person may have been exposed to tuberculosis bacteria. However, the size considered positive can vary based on individual risk factors and medical history. It's important to note that the tuberculin skin test does not distinguish between latent tuberculosis infection, where the bacteria are present but inactive, and active tuberculosis disease, which is contagious and has symptoms. Therefore, if the test is positive, further evaluation is needed. This may include chest X-rays and sputum tests to confirm if active disease is present. Several factors can affect the accuracy of the test. For instance, individuals who have received the Bacillus calmette-guerin vaccine may receive false positive results. On the other hand, people with weakened immune systems or those who have been recently exposed to tuberculosis may get false negative results. In summary, the tuberculin skin test is a valuable method for diagnosing tuberculosis by assessing the immune response to tuberculosis proteins injected under the skin. It is a widely used and cost-effective screening tool that helps identify individuals who may have latent or active tuberculosis infection, guiding further medical evaluations and treatment options. If you have concerns about tuberculosis or the tuberculin skin test, it is always best to consult with a healthcare professional for personalized advice.